Good morning on my behalf as well. My 20 years of industry of healthcare, data and analytics makes me think that this is most inspiring times we are ever seen when we think about data and healthcare industry. Big platform giants are changing the way we think about our industry, and also the amount of data that's available for broader use of personalized medicine innovations are there. So potential is huge, but we also need to define rules for the fair use of data and more transparent use of data. I think there are many ways the platform giants are changing the industry. First of all, they are very good in matching the supply and demand and getting rid of all the excessive costs by using data and matching the supply and demand. But at the same time, they are also empowering patients and they are disrupting the industry. So there are many untraditional players that enter the markets and change the way we used to think about healthcare services. So patient forums are there, places to meet. Patients with rare diseases can find peer support, can change their ideas and find support for their diseases. But at the same time, those big players are taking hold of lots of personal data. So the platform companies, they are changing a lot, relief to the physical pains, but at the same time, they are also creating social pains like us, not belonging to the communities. So I think there are many tricky questions we need to talk when we talk about the current way of using healthcare data, the endless potential of using healthcare data. At the same time, I think the whole industry is getting into new phase and it needs to be mature. The whole thinking about data economy is about to mature and the role of big platform giants is changing. So this study from Open Data Institute shows the controversy in data ethics. Only 3% of people are saying that they trust in social media organizations. At the same time, they share an ever increasing amount of their personal, very sensitive data on these platforms. And then they are saying that 59% trusts on public service providers like NHS. In Finland, I think this trust is even higher. According to a survey we made, about 80% of Finnish people say that they trust on public service vendors, service providers, and the healthcare sector. So, but still, 87% of people say and feel that it's important that organizations that use their data use it in an ethical and transparent way. So there's controversy. We are very open of sharing data. At the same time, we are very cautious about ethical topics. So I think that there's a room for more understanding coming from government services, government role, also the role of the companies, and also those companies that treat our data in a responsible way. I think these headlines from the past just show and demonstrate the fact I was telling. There are lots of new players that enter the market and change the way we used to think about healthcare delivery and about our health and well-being data. It's much broader than just the traditional data coming from registers and old systems. So I think what's needed, and when I started this speech by saying that the momentum for changing the rules for data economy or platform economies is now, there are more and more understanding from the authorities, more and more concerns about big players being too big and regulators starting to think with the GDPR in Europe and some other regulations trying to limit the power that these platform companies have in our use of the personal data and also the effect they have in our lives. So I think there's increasing amount of understanding the special role that these companies play for us and for our everyday lives. At the same time, people are getting maybe a little bit more concerned about data breaches, and there's need for more fact-based information. So with this understanding, I think we will have in the future much more choices. We need to have choice. We need to be able to choose between those services that are based on facts and research data, and that kind of evidence that comes from the web. The fake news is changing the way we think about use of data. There are many examples that we need more health literacy. We need more data literacy in general, and we need more powerful tools, more transparency in the use of the sensitive data. And I think that responsible players that are open and good corporate citizens, also when it comes to the responsible use of data, will be much stronger in the future, because it's something that's bubbling under. So if we want to create successful digital services for well-being and health in the future, we need to embed things like ethics, reciprocal benefits for patients and individuals from the authorities, the way we use and way they provide services. Patients need to get value from data donations and the use of the personal data. Trust mechanisms, how we can build those into the digital systems, that's also very crucial. And then how to build in privacy, how we can alter that insurance companies cannot perhaps see all that data that's needed by the health professionals. Those are the big challenges we need to solve, and that's one of the attempts Sitra is trying to solve in the project called Fair Data Economy, Human-Driven Data Economy. How to go from platform-dominated or state-dominated data economy models to human-driven European data economy models and business opportunities with increased data sharing, open and transparent data sharing, more open ecosystems for building new services for individuals. That's what we think that is needed for a sustainable future. So when we speak about fair data economy, we focus on that part of data economy that produces services and database products in an ethical manner. And fairness means that needs of all stakeholders, us as individuals, also society's need for transparency and business benefits for the companies, they are all balanced. And it all builds on a transparency and consent from the individuals. It's more control for the individuals on how personal data can be used. So Sitra is a 50-year-old organization under the Finnish Parliament. We call ourselves a think, do, and connect tank. And that's a very nice way of putting that. One of the focus areas we are now, what we normally do is the sense making and fact finding. We do lots of surveys, but also we do some practical experiments, pilots to find out what are the enabling technologies, what is needed frameworks to make fair data economy to be the true future, the kind of practical ways of building this sustainable future for Europe. We are working at different levels, mindset change, enabling technologies, enabling models, and also doing surveys. So let's go back to the wearable survey we just made. This is a very fresh results from that survey. And we made a survey in 4 European countries. About 4,000 respondents responded to this survey, and it was interesting there to see some differences between different countries. But overall, people who were familiar with wearable devices had a very positive attitude towards data sharing, and there was more and more potential for growth also by donating data. The Finns appear to be using different kind of wearables for a longer time than people from the Netherlands or France or Germany. Maybe that's our love for tech that makes that difference there, a small difference, but anyway. Quite high amount of people had already tried or sharing the data with professionals, and that's a very good sign if they plan for the future healthcare services. People are testing and wanting to share their personal data coming outside from the traditional systems. So, and when we asked what kind of new services would you be most interested in, holistic approach to well-being, personal food and nourishment consulting was one of the key topics. And I think that's a big benefit. If you are taking some kind of drugs or medication, it's essential that doesn't have any adverse effects considering your nutrition. As an asthmatic person, it might be good to know when it's good time to go for jogging, when the air pollution levels are okay for you to go out for exercise. These kind of topics are very typical and very easy to understand why we need data coming outside from the healthcare systems as well. It's open data, it's our lifestyle data, and data should be tailored to our lifestyle needs. So, and then if you look at the motivation factors, strong privacy protection, that's needed. That's an hygienic factor. There needs to be privacy protection when you are handling sensitive data. And of course, easiness of use, easy to use digital services. All should start by designing the services and make those services relevant to individuals. So that's one of the key findings also in this survey. You will find more information later on. So to the question, is data needed? I think the answer is definitely yes. It's not a snake oil, it's a necessity for the future healthcare services. We need more use cases to understand the role of data, and we need more health literacy in creating the data. What's coming from medical devices? There are stricter regulations, but also data coming from your everyday life. It gives patterns. It shows how you are feeling, how you are doing. That's needed for real-world evidence. So the future pools of data will be much more scattered and varied than what we used to think. We cannot really imagine the potential, what's needed in data handling capacities. And also, I think we need to have individuals as data collection points. It's crucial that we integrate different data, well-being data, data coming outside from traditional systems based on individuals. And then we need a mindset change. Professional agents who focus on curing and caring, they need to respect the individuals and understand that people will share a lot of data on social media, and social media is very good in connecting with people. So how we make trust, how we create respect for individuals, that's crucial for professionals to understand. And then we can take as an individuals after our care paths or treatment periods, we will be empowered by the use of data in our heal and deal processes. We can use a much more information. We can monitor the progress we are making by using different kind of wearables. So I think it's evident that the roles of professionals and patients are getting more mixed. But then we should be very clear on health data literacy and different categories of data, how it can be used. But mindset shift for different kind of future needs to change right now. So let's spend a moment by imagining 2025. This is the future we are aiming to create. You've been feeling a little bit low in your energy levels, and you feel that there's a change, need a change in your lifestyle. And then you heard that in the App Store, there's a Live Better app trademarked with fair data. So you know that, okay, this respects my individual rights. This is the ethical use of data. Guarantee that those service providers, data holders who produce the service for me respect the ethical rules and guidelines, transparent use of data. So, okay, I feel okay to download the app and know that it works for me and I have right to be forgotten whenever it feels so, and all data is removed from the app. So I grant a permission to this app, And the app will go behind the scenes and combine my personal purchase data into my official health records coming from Kanta. Kanta service, that's a Finnish national storage of healthcare data, the centralized way to gather all data coming from registers, medication data, and individuals have consent for the use of that data through Kanta services. So combining purchasing data, Kanta service data, the official data coming from healthcare registers, and my sports tracker app, that happens seamlessly, and I control the way that data is used by using the consenting mechanisms there. This is the way what we are thinking the future should be. This is the way the fair data economy will look in the near future if we manage to embed the European values into the design of services. And if we manage to change our mindset to that, we need a broader set of well-being data for future healthcare. We are going to publish a white paper telling the guidelines for the European data strategy and how we could change the healthcare systems in the future to cover this kind of topics. And also the findings from the wearable survey we made will be available for you very soon. If you go at the Citra's website to the MedTalk side, you will find those papers and instructions there. It's interesting, so stay tuned. And with this, I think that I would like to conclude by saying the future is made today, but we need to make it together. We cannot rely on professionals for our own health, and professionals cannot stay neglecting the patients. It needs to be interactive, and it needs to be like a common initiative working for the brighter future, more human-centric future. Thank you.